Now I'm going to talk a little bit about cholesterol. And what cholesterol is, it's a waxy substance that our body needs to function properly. We absolutely need cholesterol, but our body makes all the cholesterol that we need. Our liver makes cholesterol, but we can also consume cholesterol from our diet, namely animal foods. That said, processed foods, even if they are vegan, will raise the cholesterol level. Now, cholesterol is carried in the bloodstream by lipoproteins. So when you have your blood work and you have your cholesterol levels checked, we're not actually checking those little cholesterol particles. What we're actually measuring are the lipoproteins. We're measuring the LDL, which is the low density lipoprotein, which functions to transport cholesterol from the liver to cells, to the arteries, to deposit in the lining and lead to plaque buildup. And then there's also HDL, which is also called high density lipoprotein, which carries cholesterol back to the liver so that it can be broken down and then ultimately removed from the body. Now, as cholesterol levels increase, the risk of coronary disease also increases. This is data from the Framingham study of people within Framingham, Massachusetts. It looked at patients or subjects who were 40 years old and what their cholesterol was at age 40. Those who had a lower cholesterol, those are the orange bars, had the lowest lifetime risk of coronary artery disease compared to those who had the highest cholesterol levels. These are people who had the highest incidence of coronary artery disease. Now, the EPIC study specifically looked at cholesterol levels based on diet. So meat eaters tended to have higher cholesterol levels, whereas vegans tended to have lower total cholesterol levels, and fish eaters and vegetarians somewhere in between. So a plant-based diet does lower cholesterol. And more specifically, this is taken from a paper that looked at several different studies that were dietary interventions to help to lower cholesterol. So a plant-based diet in all of these studies lowered total cholesterol, that's TC. It also lowered LDL cholesterol, that's the LDLC. And the effect on HDL, or high-density lipoprotein, tended to be fairly neutral. In some studies, there was essentially no change. In some, there was a drop. In some, there was a raise in the HDL cholesterol. The bottom line is plant-based diets definitely do lower cholesterol. I should say healthy plant-based diets lower cholesterol. Now, these are the numbers from one of my patients. This is a 53-year-old woman who initially saw me back in 2019, and we checked her cholesterol levels, and they were high. Now, to be clear, this is a woman who had no other heart risk factors. She doesn't have high blood pressure. She doesn't have a strong family history of heart disease. She just had high cholesterol. So we talked about what we could do to lower her cholesterol levels, and she decided that she wanted to adopt a healthy plant-based diet. So we rechecked her cholesterol 3 months later on a healthy plant-based diet, and her LDL cholesterol, or her total cholesterol, dropped from 252 down to 192, and her LDL cholesterol plummeted from 164 down to 106. Now, we actually recently just rechecked her cholesterol levels, and she's remained on a plant-based diet, and her cholesterols remain nice and low. So diet can be very potent in lowering cholesterol. That said, cholesterol medications may be appropriate for some people. Cholesterol medicines, they lower cholesterol, but they can also reduce the risk of a cardiovascular event. Now, we have two different categories of people. We have what's called primary prevention. Those are people who've never had any type of heart problem before. And then we have what's called secondary prevention. And that is somebody who has already had a heart attack, or we know has plaque in their arteries, or has had a stroke. And you can see from the graph, if you look at that, the blue line, that the lower the cholesterol, the lower the risk of event rates. Now, in the so-called primary prevention, people who've never had an event, there is that association, but it's certainly not as steep of a line between cholesterol and event rates. Now, what is a statin? A statin is a cholesterol medicine, is also known as an HMG-CoA reductase inhibitor. It is a medication that blocks the HMG-CoA reductase enzyme in the liver and helps to block the production of cholesterol by the liver. And it is the most common class of cholesterol lowering medications. It can stabilize and it can reduce plaque in the arteries, in addition to its ability to lower cholesterol levels, and it actually can reduce the risk of heart attack and stroke. So who should receive a statin for secondary prevention? So anybody, regardless of whether you're on a plant-based diet or not, all patients with atherosclerotic cardiovascular disease should be on a statin. So if you've had a heart attack or a stroke, if you have a history of angina or heart-related chest pain, if you've had a stent, if you've had bypass surgery, or if you have peripheral vascular disease or plaque within the arteries of the legs or the neck, you should be on a statin to work in conjunction with your healthy lifestyle to reduce your risk. So what about primary prevention? And the data for, if you've never had a heart problem before, it's not as strong, but there is some evidence that in the right people that a statin can help to reduce risk. So a statin can be beneficial and is recommended in somebody who's a diabetic over the age of 40 to help to reduce risk of heart attack and stroke. If you have an LDL cholesterol that's over 190, and that cutoff is chosen because people who tend to have cholesterols that high, it's not because they have a bad diet, it's because they have some sort of genetic abnormality or a familial hypercholesterolemia that causes their cholesterol to be at such high levels. And these people are at significantly increased risk of heart attack and stroke with time. So the recommendation is there that these people should be on a statin medication in addition to prudent lifestyle. And then others, depending on their risk, and that's what we call shared decision making. So I will often sit down with my patients and say, this is, these are your risk factors, and we have ways of calculating cardiovascular risk, and we look at what somebody's risk is over the course of the next 10 years. If the risk is somewhere between 7.5 to 10% or higher of having a heart attack or a stroke in the next 10 years, that's somebody who a statin medication might be reasonable for. And again, I don't force anybody to take pills, but we always talk about what the potential benefits of the medication are. Now, there are a lot of myths out there about statin medication, so I want to talk about these a little bit. So, statins will hurt my liver. And the truth is, drug-induced statin injury is so rare. I, in my career, have not seen one. There's never been somebody who has been required a liver transplant because they were put on a statin and it's destroyed their liver. Another myth, statins will cause muscle aches. Yeah, statins actually do in some people cause muscle aches. It's about 5 to 10% of all people. It's not a permanent damage to the liver. You stop the statin, the muscle aches will go away. There's a very rare thing called rhabdomyolysis. I've seen a very small handful of patients who've had that from statin medicine. And again, that is something that with stopping the medicine gradually, that will also improve with time. And those people who do have muscle aches on one statin often will be able to tolerate a different statin. Another myth, statin causes diabetes. Now, statins do not take somebody who has perfectly normal sugar and transform them into being a diabetic. What it does do is a statin does, as part of its action, it does slightly increase the glucose level. So if you're somebody who is pre-diabetic right on the edge of diabetes, it might push you right over that classification such that you are now considered to be a diabetic. But the benefit of this person being on a statin typically in reducing the risk of heart attack and stroke will outweigh that small change. Another myth, statins cause dementia. The truth is there really is no proven link between statins and dementia. Statins actually do reduce plaque over time and may actually reduce the risk of memory problems in the long term. And the final myth, if you're a skeptic, you may be thinking Dr. Shenkman is a shill for big statin. And at this point in time, there really is no big statin. Most statins are generic, and there is no money to be made in prescribing statin medications. So finally, the point of my talk is that you can be successful with a plant-based diet in helping to keep your heart healthy for years to come. It doesn't matter where you are. If you're concerned about your family history, if you're somebody who's already had something happen to you, if you've had a stent, if you've had a heart attack, it's never too late to start taking good care of your body, putting good plant-based food into your body. And a plant-based diet goes hand in hand with good medicine for the long term. It's not medicine versus diet. It's a combination of a plant-based diet and good medicine where appropriate to keep your heart healthy for years to come. And I guess I chose this picture for success. This is me back in 2013 competing at the Maccabiah Games Olympic distance triathlon in Israel. And finally, if you want to learn more, read more, buy my book. It's available on Amazon, The Vegan Heart Doctor's Guide to Reversing Heart Disease, Losing Weight, and Reclaiming Your Life. And if you happen to live in the Los Angeles area, I'd be glad to see you as a patient. If you live in California, in the state of California, the only state where I have a medical license, I can see you as a consultation via telemedicine as well. And I think from here, I will open it up to questions, and I thank you for the opportunity to speak.